As some of you may know, February is National Heart Awareness Month, and we have the privilege of having Dr. Matheson with us today. Dr. Matheson, how are you?
Yeah, very good, thank you.
Thank you for being here.
Thank you.
Dr. Matheson, let's dive right into it. Why is heart awareness important?
Well, heart awareness or heart disease is the number one cause of death in the African American population right now, and it is something that is preventable if we can catch things at the appropriate time, and it's something that we can take responsibility for and to change certain lifestyles to correct these things. Heart disease is a number of different things. It's hypertension, it's diabetes, it's elevated cholesterol. All those things all contribute to heart disease. So it's important that we get control of those things.
Okay, so now just understanding that, receiving that information, so when we think of cardiovascular disease, or what's also known as heart disease, we instantly think of a heart attack. We instantly think of strokes, but clearly those aren't the only forms of cardiovascular diseases.
That's correct.
So now you said that they're preventable.
Yes.
How so?
We can look at hypertension. If we can catch someone and treat them, we can prevent the sequela of hypertension, which is stroke and heart attacks. Hypertension can be controlled with as simple as changing our diet, decreasing our salt intake. It can be decreasing your weight by 5 pounds can decrease your blood pressure, which in turn prevent heart attacks and strokes.
Oh, wow. Okay, so now some of these things are genetic. You know,
Yes.
like my dad is a diabetic.
Yes.
You know, my maternal grandmother has hypertension. So I presume that I'm more susceptible to contracting those diseases, or developing those diseases rather. So what do I say to my physician about these things?
Well, it is true there is a genetic predisposition to certain things, such as diabetes, such as cholesterol. And knowing that and giving your physician your family history, that should guide the physician in how he should evaluate you, how he should test you, and monitor you for the rest of your life. So those are the key to how you manage. Is if we can catch you at a stage where you're pre-diabetic, we can treat it and prevent it.
So sometimes we think that we know more than our doctors. You know, as patients, the reality is we really don't. So I give you a rundown of what happens when I go to the doctor. The nurse, she takes my vitals. She checks my blood pressure. She puts something on my finger. I'm not sure what she's checking for. She checks my weight. She checks my height. Then the doctor herself, she checks my lungs. She checks my heart. She checks my ears, I presume my tonsils. She also checks my eyes. Where has she checked for hypertension or diabetes and things like that?
Well, I think initially when you came into the doctor's office, the first thing that they do is they get a history from you. And that history is your personal history and your family history. And those are key to how it should guide your physician as far as where they should go and how they should test you. Secondly, the nurse took your vital signs. So the clamp on the finger, she may have been checking your oxygenation level. The blood pressure is checking your blood pressure. And they also listen to other systems in your body to see if those are normal or not. Now, as far as heart disease, the blood pressure is one of the key things that they're checking. Is your blood pressure 120/80 or less? That's what we would consider normal. What is your weight? What is your height? And from that, we calculate your BMI. Your BMI gives us your risk of heart disease. So those are the things that we're doing just on your visit to evaluate your cardiovascular status. In addition, based on your family history, you said your father is diabetic. One of the things that we may want to do is to send you to do certain blood tests, like a fasting glucose or hemoglobin A1C, which gives us a 3-month picture of what your glucose status was. And that helps us to decide, well, are you normal? Are you pre-diabetic? Or are you diabetic? And knowing if you're diabetic, we have to remember diabetes is one of the leading causes of heart disease in African Americans.
Okay.
So we are looking at different reasons and causes that may lead back to heart disease.
So now we go to take blood work. Now I presume that when I go to take blood work, if I don't hear anything from the doctor or from the lab, everything is okay. Is that a safe assumption?
It is not a safe assumption, but I think the responsibility is on the physician and the patient to follow up their results and make sure that their results, not hearing back that of what your results are, may not be a good thing, and you may miss that you were diabetic for a whole year, or so you should follow up and check.
Oh wow, okay. I'll definitely give them a call after this interview. Okay. Now sometimes we ignore symptoms. Sometimes we ignore signs. I woke up this morning, I'm feeling a little winded. Oh, maybe because I left the window open and I'm maybe coming down with developing some type of cold. What are some of the symptoms of cardiovascular diseases?
Some of the symptoms of cardiovascular disease, and I just want to make one point before I do get to the symptoms of cardiovascular disease, is that hypertension, there is no symptoms. By the time you have symptoms, you already have a problem. So the key is to pick it up before there are symptoms. The symptoms of hypertension may be headache, shortness of breath, chest pain, but by the time you're at this point, now you're not talking about prevention, you're talking about treatment. Our goal is to deal with things when they're in the preventable stage and not in the treatment stage.
Okay, so now if you could give me 7 steps to having a healthy heart, just 7, what would they be?
Just 7, that's all?
I mean, if you want to give me more, more is fine, but...
I reflect back on a conference I attended with the Association of Black Cardiologists, and where they came out with 7 steps for a healthy heart life or heart awareness or to prevent heart disease. The first one they listed was to be spiritually active, and what they found is that when they compared, and these are studies, people who attend a place of worship versus people who do not. People who attend a place of worship actually live 14 years longer than people who don't. And they try to look at, is it because of the social engagement or whatever? And, as believers, we know why it is. So that is one of the first steps. The second step they mentioned is take control of your blood pressure. And I look at that in different ways. One is, know what your blood pressure is. But also, there's so many times I get calls or see patients, they have the diagnosis of hypertension, and instead of taking their medication consistently, they wait until they get the signs. By the time you get the headache, it's too late sometimes. So be consistent, follow your physician recommendation, and control your blood pressure. However, whether it's weight or medication. Cholesterol is one of the key things, the third step that they said that we should control our cholesterol. We are genetically predisposed to elevated cholesterol, and then there's the environmental interaction. We cannot control the genetic predisposition, but we can control the environmental. The environmental things as what we eat, how we eat, the exercise, decreasing our weight, decreasing our salt intake. Those are things that we can control. The fourth is we talked about it and we hinted is to make sure if you have a family history, check your blood sugar. It should be, on depending on your age, on an annual and your family history on an annual basis, you should check that and know your result. Know your hemoglobin A1C. That is key. The other is they mention, and which I stress the point, enjoy exercise. So when exercise becomes work, then you're not going to do it consistently. It's another job.
Okay.
So, and eat smart, which is, we mentioned earlier, there's certain lifestyles that we were accustomed to, whether it's familial or whether it's our own, that we have to control how we eat, what we eat.
Man, my family is Southern, so I don't know. The yams, collard greens, mac and cheese.
I know.
I need those in my life, Dr. Madison.
You're gonna have to take a little Southern out of it and keep the mac and cheese, but once again, it's moderation, and I think that is key. And we also have to keep in, what you may do if you are normal versus my friend who may have some cholesterol problems, and we have to be mindful of who we're with and who our associates are.
Okay.
There's a no-brainer here, which is step number 6, is don't smoke. That's an easy one. I mean, lung cancer and heart disease. That's it.
The packages alone.
That's it. Lung cancer and heart disease.
Okay.
And I think one of the things that you mentioned earlier, step 7, which is access better health care. Your question is, and which was a legitimate question, how do I know? We have to be educated when we go to our physician. We cannot just rely on the physician. We should not fear our physician, and be able to give the physician information that they can make a diagnosis. Many a times patients, come into the office, well, you're the doctor, you should know. I only know when you give me the information to figure it out. So, accessing better healthcare is an important thing, that we can get proper preventative care, proper management, proper testing, and hopefully that we can be grandparents and pass on our pearls of wisdom to our grandchildren.
Got you. Awesome. Cardiovascular disease is the #1 killer of Americans, but studies have shown that it's the #1 killer of minorities. Could you tell us why, or your opinion?
I think it is being studied, and you could say well studied, that there are some what we call health disparities among the different populations. And we don't have an exact answer for that. It may be due to socioeconomic status. It may be due to lack of health insurance for certain populations. It could be due to a language barrier or cultural barrier between the physicians and the patients. So there's a number of things that are being looked at, but I think the key point to whether the health disparities exist is that we still should focus on prevention prior to treatment for heart disease, and should focus more on the minority.
Understanding that February is National Heart Awareness Month, there are different initiatives like the National Wear Red Day or the Million Hearts Initiative, right? How can the average person spread awareness? How can they stay informed? Because the information is always changing. Studies show that by 2030, 23.6 million people will be affected by heart disease.
I think firstly is that you have to take account of yourself, and you should be doing your prevention, your health care, your visits. I think there are other venues such as this that we can dispense information to different organizations and to our own congregation. There are websites that we can go to. The American Heart Association has a website. The Association of Black Cardiologists. I think the New York State is bringing programs into institutions as this to educate and our congregants. So there are many venues that they're being opened up that we can use to educate.
Awesome, awesome. Well, Dr. Matheson, thank you so much for your time. Thank you for your wisdom. And these are definitely things that we'll put into practice.
Thank you.
Thank you again,
You're
sir.
welcome.
For more information on the National Heart Association or for outlets to other heart awareness websites, simply visit our website at www.cccinfo.org.